Good afternoon. We have portfolio questions on health and wellbeing. Question number 1, Aileen McLeod.
To ask the Scottish Government what progress is being made with the Detect Cancer Early programme.
Cabinet Secretary Alex Neil.
Presiding Officer, since February 2012, 3 phases of public awareness campaigns have run: a priming campaign aimed at tackling fears and negative attitudes about cancer, a bold breast cancer awareness campaign in September, and more recently the campaign to encourage uptake of bowel screening. The initial evaluation of the social networking campaigns has been encouraging. Published data indicates more women are reporting breast symptoms and more people are inquiring about participating in the bowel screening programme. It is too early yet to assess what impact this is having on early diagnosis. A GP contract proposal to encourage primary care to contribute to screening uptake is at an advanced stage. A refresh of the Scottish referral guidelines for suspected cancer is underway, led by Healthcare Improvement Scotland. The programme's £30 million funding is supporting increases in diagnostic, screening and treatment capacity so that the 62 and 31-day cancer access standards are maintained. Additional capital and revenue has been made available to support an increase in colonoscopy capacity. Baseline setting and submission, analysis and reporting of staging data to monitor progress toward the programme aims is also well underway.
Aileen McLeod.
Can I thank the Cabinet Secretary for that comprehensive answer? I had the privilege of visiting the Teenage Cancer Unit at Gartnavel recently and would commend a visit to the Cabinet Secretary to see just what a fantastic facility this is for helping our young people fight cancer. Will the Cabinet Secretary therefore join with me in applauding the important work being done by the Teenage Cancer Trust through schools, colleges and universities in helping to raise awareness among young people of the importance of early cancer detection, so that they can discuss cancer and the benefits of early presentation with their peers and older family members in an informed way?
Cabinet Secretary.
Presiding Officer, I do indeed applaud the important work being done by the Teenage Cancer Trust in raising awareness of the importance of early detection of cancer. As a result of the Teenage Cancer Trust presentations in schools, this awareness raising has been shown to extend beyond the young people who attend the talks and benefits a wider circle of friends and family, contributing positively to the overall aim of improving early diagnosis. For the Detect Cancer Early programme's social marketing campaigns to be most effective, it is important that the target audience is reached in as many ways as possible. That is why our programme is engaging with and supporting the Teenage Cancer Trust education programme. That provides them with the information that encourages them to give their older family members a nudge to make sure they know the benefits of early presentation or to find out more about screening participation. Breaking down barriers and getting people to talk about cancer is an important part of the Detect Cancer Early programme.
Sir, can I welcome the measures that the Minister has outlined, but can he offer me an assurance about what is happening for those patients who are awaiting secondary treatment, early detection and initial treatment, while of course extremely important and all of the Government's efforts are very welcome in this regard. They will not be enough if there are then further waiting periods for follow-up treatment such as radiotherapy.
Cabinet Secretary.
Presiding Officer, we haven't set specific targets in terms of the number of days for the follow-up treatment because that's very much determined by the clinical situation for each patient. It is governed, however, by the clinical guidelines in relation to follow-up, and as far as we can tell, and we do monitor these matters fairly closely, as far as we can tell, those clinical guidelines are being adhered to throughout Scotland.
Thank you. To go to the older end of the age spectrum, can the Cabinet Secretary tell us what progress is being made with regard to the programme in relation to the over 70s age group, which, as you will be aware, frequently has high incidence of cancer and often doesn't present with symptoms or get a diagnosis until it's too late?
Cabinet Secretary.
Presiding Officer, the evidence we have is that these programmes are actually having an impact in the older age group as well as in younger age groups. But I am happy to send the member some more detailed information in terms of uptake for the older age groups.
Malcolm Chisholm.
Can I congratulate the Government on the Detect Cancer Early programme, which is an excellent initiative, but people are approaching me, as I suppose they are the Minister as well, about if and when other cancers will be brought onto the programme, and in particular people have raised with me recently cervical cancer and prostate cancer. So I wonder if they will in due course be brought onto the programme.
Cabinet Secretary.
Presiding Officer, we will be giving further consideration to the future of this programme once we've done a proper evaluation on the impact, particularly on breast and bowel. And the early indications, as I said, is that it is a very effective programme indeed. But we have to wait for the evaluation before we decide to spend additional resources in covering other types of cancer.
Question 2, Bob Doris.
Asked the Scottish Government how it ensures that the health and wellbeing needs of adults with learning difficulties are taken into account when service redesign is being proposed at a local level.
Cabinet Secretary.
The decision to redesign services is entirely a matter for local authorities. However, the Scottish Government expects local authorities to listen to people with learning disabilities and their carers to take into consideration what will work well for them.
Bob Doris.
I thank the Minister for that answer. The Minister will be aware that Glasgow City Council has decided to close 3 day centres for adults with learning difficulties. These closures will have a massive and detrimental impact on the health and wellbeing of service users and carers across the city. If they were schools, ministers would have the power of calling over any decisions. What powers does the Health Minister have, given the health impact on my constituents, to intervene, particularly given the flawed and predetermined consultation process, as I believe that further powers, including the possibility of calling, are required to protect vulnerable constituents that I represent?
Minister.
One of the benefits of the integration of health and social care is the way in which it will bring together our health service and our social care services to be much more effectively planned and delivered in a local way, which reflects the needs of the local population. However, the member will recognise that it is ultimately up to local authority to use their resources and to provide services in a way that they feel fits their local community's needs. What I think is extremely important in the process of considering what I know at times can be quite a challenging issue is that the Council have a process which allows for genuine consultation with those who have a learning disability and their carers, and that those who participate in that process can have trust in the way in which it has been taken forward by the local authority. And the process that's been taken forward in Glasgow, I think it's important that the Glasgow Council continue to look at what they can do to address the concerns which are being expressed by both carers and those who make use of these centres, and how they can achieve an outcome that meets the needs of those who use these particular services.
Question number 3, Tavish Scott.
Presiding Officer, to ask the Scottish Government what recent assessment has been made of dementia services in NHS Shetland and the availability and retention of staff to deliver these.
Cabinet Secretary.
Presiding Officer, dementia services in NHS Shetland, including any staffing issues, are assessed by Scottish Government officials as part of the twice-yearly visits to all NHS boards to review mental health services and as part of the annual review of boards. A local dementia action plan for Shetland was produced for 2012-13, and the board and local authority are working together to redesign services to better meet the needs of people with dementia.
Tavish Scott.
Thank you. Can I thank the Cabinet Secretary for that reply? Would you understand a constituent of mine who does have dementia and has been regularly transferred to the Royal Cornhill Hospital in Aberdeen, and the circumstances, the very difficult circumstances that's creating for his family? Would he undertake to work with NHS Shetland to look at how best services can be delivered with investment involving both the staff that are necessary and the potential for capital investment for an appropriate facility, so as to find some way to minimise that amount of travel, which of course inevitably means that a patient is very much further away from the family at these extremely difficult times?
Cabinet Secretary.
Presiding Officer, I'm actually aware of the circumstances described by the member, and I'm extremely sympathetic to the point he raises. We do recognise there are particular challenges in the island communities because of the number of people involved, and therefore specialist services sometimes are required that are only available in the mainland. Shetland has a dementia services manager funded by the Scottish Government and Alzheimer's Scotland, a clinical nurse specialist in dementia and 4 dementia champions. There's also a great deal of community activity in Shetland to support people with dementia, including Ansbury's supporting housing scheme with a team of workers led by a service manager, which provides an alternative model to going into a care home or acute. But I am aware of the specific challenges around the kind of case that's referred to by the member, and we are looking at whether in future we can handle some of these cases, more of these cases, in Shetland itself.
Mary Scanlon.
Thank you. Further to Tavish Scott's question, I understand that the new dementia strategy due next month will recommend 4 test sites to support people in the mid to later stages of dementia. Can I ask if one of those sites could be in a remote and rural area such as Highland, or indeed one of the island groups such as Shetland?
Minister. Cabinet Secretary.
Presiding Officer, we are in the process of finalising the dementia strategy, but I'll certainly take into consideration the very substantive point made by Mary Scanlon.
Question number 4, John Wilson.
Thank you, Presiding Officer. To ask the Scottish Government when it last met representatives of Healthcare Improvement Scotland and what issues were discussed.
Cabinet Secretary.
Presiding Officer, the Scottish Government is in regular contact with Healthcare Improvement Scotland. There are monthly meetings arranged between the Scottish Government and the HIS Chief Executive. The last meeting took place on the 11th of April 2013. At times there can almost be daily contact where operational issues are discussed, e.g. the Scottish Patient Safety Programme, hospital standardised mortality ratios or other HIS organisational issues.
John Wilson.
Thank the Cabinet Secretary for his reply. Could the Cabinet Secretary indicate what discussions he has held with HIS on the progress being made in terms of risk management associated with death certification, and in particular the Blake-Stevenson's report on death certification evaluation? And while the random samples of MCCDs only highlighted that 3% were not in order, however, any delay in funeral arrangements being made can and does lead to further distress to relatives during their time of grief. What further work will be taken forward on this issue?
Cabinet Secretary.
Presiding Officer, I'm very much aware of this issue, and we're talking to his and many other people about how to address these concerns. The system is being developed in such a way to minimise delays, and processes are being put in place to ensure medical reviewers can assess the information they need quickly to enable reviews to be carried out within a day or so of registration. We anticipate that once the system is up and running, there would be little detectable delay as a result of the new system in the vast majority of cases.
Jackie Baillie.
Would the Cabinet Secretary agree that with the recent scandal of doctored inspection reports resulting in a lack of confidence in Health Improvement Scotland and the forthcoming integration of health and social care, does he agree with Labour's proposals for a new independent scrutiny body?
Cabinet Secretary.
Presiding Officer, first of all, I totally disagree with the description that Jackie Baillie gives about doctored reports. No reports have been doctored, as she calls it. And can I say that as far as our proposals are concerned, we already have independent arrangements for inspection of hospitals, whether it's in relation to issues like C. diff or in relation to older people's circumstances in hospitals. And of course, we have an independent inspection agency to cover our care services in Scotland as well.
Question number 5, Dennis Robertson.
Thank you, Presiding Officer. To ask the Scottish Government what care and support is available for stroke patients.
Minister.
Our Better Heart Disease and Stroke Action Plan, backed by over £1 million of funding each year, contains actions aimed at ensuring people with stroke get access to effective, safe and person-centred care as quickly as possible. Full implementation will help ensure we maintain momentum and continue to improve the quality of care and support available to people with stroke. NHS Scotland has made great progress in improving the outcomes for people with stroke. Between 1995 and 2010, we saw a 60% reduction in the number of people who died prematurely from stroke. In 2011, stroke deaths fell by 5.7% on the previous year.
Dennis Robertson.
I thank the Minister for that response. The Minister is probably aware of a survey that was conducted by Stroke Association UK, which states that over 42% of patients lacked emotional support after their physical needs were met. Can the Minister reassure me that these figures are better in Scotland in terms of the emotional support given to our patients, and what more can be done to reassure those patients awaiting the emotional support after physical needs are met?
Minister.
I am aware of the survey that was undertaken by the Stroke Association, which rated hospital care in Scotland as being high, but it also recognises the need for further improvements, particularly around emotional and psychological support. And any healthcare condition can, of course, have a wider impact than just the physical element of it in terms of its impact on an individual and their family's emotional and psychological wellbeing as well. That's why in our new mental health strategy we recognise the importance of providing a better response to those conditions such as stroke, to be able to get the right type of emotional and psychological support. A key element to addressing this type of issue is to improve access to psychological therapies, or talking therapies as they are often referred to, and that's why we are committed to delivering faster access to psychological therapies, and we have underpinned that by our HEAT target, which will ensure access to such therapies within 18 weeks by December 2014, which will assist patients who may have suffered from a stroke in being able to get access to the type of psychological support that they may benefit from, which can aid and assist in their full recovery.
Question number 6, James Kelly.
Thank you, Presiding Officer. To ask the Scottish Government how it oversees the application process for community pharmacies.
Cabinet Secretary.
Presiding Officer, in my reply to Mr Kelly in this chamber on the 6th of December last year, I indicated that the Scottish Government has no role in monitoring either applications or appeals relating to the opening of a community pharmacy. These are entirely matters for NHS boards and the National Appeal Panel, respectively. The Scottish Government does, however, keep under review the NHS Pharmaceutical Services Scotland Regulations 2009 as amended, which regulate the applications process, and we propose to update in the near future the control of entry guidance, which is issued to all NHS boards and contractors.
James Kelly.
I thank the Cabinet Secretary for his reply, though I'd point out it was the Minister for Public Health that answered on December 6th and not yourself, Cabinet Secretary. That aside, I have written to the Minister for Public Health about a pharmacy application in Whittlesburn in my constituency, which has gone to the Health Board, been referred to the National Appeal Panel, gone back to the Health Board where the latest hearing has been postponed. I have real concerns about the openness, fairness and transparency of these hearings, and as such I have written to the Minister for Public Health requesting a meeting, and I would ask that that meeting be facilitated.
Cabinet Secretary.
Presiding Officer, I am aware of the particular application which Mr Kelly refers to. My understanding is around the issue of sufficient local provision, and that is the reason why, to date, the application has been unsuccessful. But I am absolutely sure my colleague, the Minister for Public Health, would be more than happy to meet Mr Kelly to discuss his concerns about the process.
Roderick Campbell.
Thank you, Presiding Officer. Would the Cabinet Secretary or the Government consider further amendment to the 2009 regulations, or alternatively to the guidance note, to provide a time limit for appeals?
Cabinet Secretary.
Presiding Officer, appeals can be very complex, and the complexities can vary from case to case depending on the merits of individual cases. This is especially so where there may be more than one interested party lodging an appeal or new evidence to be considered. I understand that the National Appeal Panel usually considers appeals in order of the date received by the Chair and aim to consider appeals within 3 months of receiving all the relevant papers. This can sometimes take longer if several appeals are received around the same time. However, I will monitor the situation, and if I believe that timescale is becoming an issue, then I will be prepared to consider the matter.
And question number 7 is from Roderick Campbell.
To ask the Scottish Government what the impact will be of the shingles vaccination programme.
Minister.
Shingles is an illness that can be particularly severe, with many people affected by chronic pain that can develop after having shingles. The vaccine we are introducing has been shown to reduce the incidence of shingles in older adults, as well as the persistent pain which often develops following shingles. There are around 7,000 GP consultations for shingles each year in Scotland. The programme will offer protection against shingles to those who are especially vulnerable and should help to reduce the number of GP consultations each year.
Roderick Campbell.
I thank the Minister for his answer. Further to my question on this matter last June, I am pleased to see that the vaccine has been introduced. Does the Minister agree with Professor Adam Finn of the University of Bristol when he says we are getting close to the point where we have the best vaccination programme in the world?
Minister.
Well, vaccine uptake rates in Scotland are consistently high, and this is in no small part thanks to the concerted effort that has been made over a number of years to raise awareness of the importance of being vaccinated against a range of different conditions. Vaccination uptake rates are rightly attracting attention from other countries, but we cannot afford to take that for granted. We are putting significant resource into ensuring that the new and extended vaccination programme that will be introduced in the coming months are effective and maintained, if not improved upon, and the uptake rates are as they have been seen in the last few years. NHS Scotland has the experience and also the expertise to build on the strong foundation that has been set down by our vaccination programme to improving that in the years to come.
Jackie Bailey.
The Minister will be aware of my support for the extension of the vaccination programme, but is he also aware of the comments made by Alan McDevitt, Chair of the BMA Scottish GPs Committee, expressing concern about the ability of GPs to deliver vaccination programmes without significant support from other health staff such as school nurses, health visitors and district nurses? Can the Minister therefore tell us what specific action is being taken to release nurses to participate in this and other extremely important vaccination programmes?
Minister.
I am aware of the recent comments that were made by Dr Alan McDevitt in the Scotsman newspaper, I believe, in relation to the extended vaccination programme. In fact, the majority of the work that will actually follow from the extended vaccination programme will be on to NHS Scotland, with a smaller portion of it onto GP practices. But what we are doing is we are working with our NHS boards and also with the Scottish Committee of General Practitioners and looking at what further additional measures are necessary to help to make sure that they are in a position to be able to help to support the delivery of what is at present a very successful vaccination programme, which I have got no doubt will be in their interest to build upon and to make sure the extended programme is successful.
Question number 8, in the name of David Stewart, has not been lodged. The member has provided an explanation, and I think we're all well satisfied with that. Question number 9, Alison Johnson.
Thank you. To ask the Scottish Government whether it will make statutory a universal entitlement to services from health visitors.
Cabinet Secretary.
Presiding Officer, we believe that legislation already adequately provides for entitlements to health services. Universal services are delivered by a range of practitioners and not solely by public health nurses. Health visitors, for example, GPs, midwives, family nurses, based on the needs of individual children and families.
Alison Johnson.
Thank you. The Royal College of Nursing, the Royal College of GPs and Children in Scotland are amongst the notable bodies calling for statutory entitlement of universal services. There is a concern that if this doesn't occur, some vulnerable children may not be identified and could miss out on interventions in the early years. The Cabinet Secretary will agree that prevention is central to improvements we can make to Scotland's health. How will the Cabinet Secretary prevent an increase in direct public costs over the long term if this right does not become statutory?
Cabinet Secretary.
Presiding Officer, I think we've got to make a distinction between two issues. One is entitlement to care, which already exists, and secondly, identifying people who, for some reason or other, bypass the system. And we have a range of mechanisms in place to try to make sure that as few people as possible are bypassed, for example, in terms of children, through the various mechanisms, nursery education, family nurse partnerships, and a whole range of other networks and mechanisms, and particularly with the integration of health and social care. One of the key objectives of that is to make sure that all those who need and are entitled to universal services, in this case health services and social care services, receive them. So I share the objective of the member. I just don't think we need to change the law in order to achieve that objective.
Question number 10, Jim Meady.
Thank you, Presiding Officer. To ask the Scottish Government what recent discussions it has had with NHS Lothian regarding the maximum level of daily fines that the Royal Infirmary of Edinburgh can impose on its maintenance contractor, Consort Healthcare.
Cabinet Secretary.
Presiding Officer, officials are in regular contact with colleagues in NHS Lothian on a range of issues, including the contract signed by NHS Lothian with Consort Healthcare for the Royal Infirmary of Edinburgh.
I thank the Cabinet Secretary for that answer. Does he share the alarm that I and people across Edinburgh felt when they learnt from the Edinburgh Evening News that Consort Healthcare could only be fined a maximum of £28.24 per day for serious failures, such as the closure of operating theatres for more than 6 hours? What further steps will the Scottish Government take to ensure that the growing mood of public outrage at the management of this PFI contract is properly and finally addressed?
Before you start, Cabinet Secretary, can I say the presiding officers do not approve of stunts that have been telegraphed in advance. Cabinet Secretary.
Presiding Officer, my concerns about PFI contracts, the Royal Infirmary, Hare Myers, Wishaw and many others, I think is well and truly on record. And certainly there are many aspects of these contracts that were signed up to which are costing the public purse very dearly. So much so that the government down south has abandoned PFI as a method of funding future capital projects. And I do share the frustration of many people about the cost of these contracts to the public sector, and we constantly review them to see if there are any ways in which we can reduce these costs to the taxpayer.
Can I welcome the fact that there are regular discussions between the Health Secretary's officials and NHS Lothian, but to return to the particular question that Jim Eadie asked, are there any possibilities of changing this particular contract, given the huge costs both to patient care and to the operation of the ERI, given the real present problem of cancelled operations and then the consequent delays?
Cabinet Secretary.
Presiding Officer, one of the unacceptable features, I think, of these contracts signed by the previous administration, I think when Sarah Boyack was a minister, is that one of the provisions in the contract is that only the contractor can reopen the contract, which is an absurd provision. And quite frankly, I think the ministers who signed these contracts have a lot to answer for.
Question number 11, Colin Beattie.
To ask the Scottish Government what action it is taking to improve the treatment of type 2 diabetes.
Minister.
Our Diabetes Action Plan, published in 2010, sets out our vision for a world-class diabetes service and offers a comprehensive and ambitious programme of work which we are committed to implementing. The Scottish Diabetes Groups have reported that good progress has been made with implementation of the plan. For example, we have appointed National Diabetes Education and Paediatric Coordinators, enabled patients to access their own health data online, established a diabetes inpatient programme and consolidated our diabetes foot screening programme. We are investing a further £900,000 in the programme this year.
Colin Beattie.
I thank the Minister for his response. What steps are being taken to ensure that there is a consistent approach to treatment of type 2 diabetes across all of Scotland's 14 health boards?
Minister.
Of course, it is a matter for clinicians to determine the type of treatment that is most appropriate to an individual patient, giving regard to local and national clinical guidelines. The member will be aware that the Managed Clinical Network has also been established on diabetes, who are looking at taking forward a prescribing strategy which is to aim to try and help to address areas of variation that can exist between the way in which patients are prescribed with different forms of medication in treating their conditions. So we are going to continue with that work and help to support the work of the Managed Clinical Network in order to try and reduce the variation in the way in which patients are treated with diabetes in different parts of the country.
John Scott.
Thank you, Presiding Officer. To ask the Minister what progress he is making with the rollout of insulin pumps in Scotland, particularly in NHS Ayrshire and Nairn.
Minister.
Well, we are making significant progress in increasing the level of pumps which are available both to those who are under 18 and also increasing the number available to those who are over 18. Some of our boards have made greater progress than others, but we recognise as a government the real difference that these can make to the lives of individuals should it be clinically appropriate for them, and it will not always be clinically appropriate for patients to move on to an insulin pump. And we are working with our individual boards to make sure that they have plans in place to be able to deliver the increase in insulin pumps that we wish to see, particularly amongst our under 18s and also for the wider patient group in general.
Question 12, Richard Baker.
Thank you, Presiding Officer. To ask the Scottish Government what its plans are for the provision of dentistry in NHS Grampian.
Minister.
The responsibility for the overall provision of NHS general dental services in the area rests with NHS Grampian.
Richard Baker.
Thank you. The increased numbers of patients in Grampian registered with the dentists are welcome, but what reassurance can the Minister give me that there is proper monitoring of these practices who have received NHS grants to establish new surgeries to ensure they fulfil the requirement that 80% of their work is NHS treatment, and also that patients registered with these practices are actually receiving check-ups and treatment at appropriate intervals? I know these are issues which have been raised too with the Scottish Government.
Minister.
Well, the member makes reference to the Scottish Dental Access Initiative, which was developed in order to help to increase the number of dental practices that will register NHS patients, particularly in areas where there was a lack of service. And he rightly recognises that there has been a very significant increase in the level of NHS dentistry being made available within the NHS Grampian area. It is part of the condition of that grant that they do have a significant number of their patients as registered as NHS patients, and individual boards are responsible for the monitoring of that. I know there have been some issues with a practice in NHS Grampian, which NHS Grampian took appropriate action to address, and I understand that they have also written to all of those practices which have received support through the Scottish Dental Access Initiative to ensure that their status remains the same and that they are delivering the services that are agreed as part of the grant's conditions. In relation to check-up rates as well, I think it's a very important point. It may be helpful if I inform the member that 83.6% of those patients registered in Grampian presented for treatment in the previous 2 years. That figure is actually higher than the Scottish average of 79.3%. So it's clear that a significant number of patients within NHS Grampian are making use of the NHS dentistry services, which we've seen a very significant increase in providing under this government. And I've got no doubt that patients will continue to benefit from that increasing level of access that's been made available to them.
Stuart Stevenson.
Is the Minister aware that 10 years ago there were areas of NHS Grampian where it was impossible to register even for private NHS dental treatment, and that some of my constituents used to travel twice a year to Budapest, to Amsterdam and other European cities for the treatment? Can he assure us that we will continue to see improvements in the provision of NHS dental care in the NHS Grampian area?
Minister.
The member makes a very good point, because there were very significant difficulties in patients in the NHS Grampian area being able to access NHS dentistry. So, for example, since 2007, in 2007 only 59.2% of children in NHS Grampian were registered with a dentist under NHS arrangements. As at the 30th of September 2011, that figure had reached 77.1%. In 2007, only 28.9% of adults in NHS Grampian were registered with a dentist under NHS arrangements, and as of the 30th of September in 2012, that figure had reached 56%. We continue to make provision under the Scottish Dental Access Initiative, which is available in the Grampian area, particularly in Aberdeenshire and in Morayshire, targeting areas where there continues to be limited access, so that we can ensure that those patients in NHS Grampian who wish to have access to an NHS dentist are able to do so.
Question 13, Willie Coffey.
Thank you. To ask the Scottish Government what recent progress there has been with the review of the individual patient treatment request process.
Cabinet Secretary.
Presiding Officer, the review report on the role and remit of NHS Board Area Drug and Therapeutic Committees and individual patient treatment request arrangements was published on Friday, the 3rd of May.
Willie Coffey.
Can I thank the Cabinet Secretary for that answer? He will be aware, of course, of the struggle that my constituent Janice Glasswell and her family endured recently, and that sadly Mrs Glasswell passed away last month. At no time did the family feel as though they were an integral part of the IPTR process, and they felt excluded from it. Can I ask the Cabinet Secretary to ensure that this changes and that all information is made available to patients and their families, and that full and concise explanations are given in writing by the clinicians when determining all future applications for access to specialist cancer drugs?
Cabinet Secretary.
Presiding Officer, I met Mr and Mrs Glasswell some time ago, and I fully appreciate the difficulties that the family are now facing. Clearly, one of the reasons we set up these reviews in the first place was because of the degree of public dissatisfaction with the current process in a number of cases. We now have the reports from Professor Swainson and Professor Routledge. We discussed those at the Health and Sport Committee yesterday. The Health and Sport Committee will be making its report and recommendations, hopefully, before the summer recess. Those recommendations made by, particularly in the case of IPTR's Professor Swainson, I believe should go a long way to assuaging the families who might find themselves in future in the same situation as the Glasswell family, and certainly that's our intention, that where the clinicians, and it's important clinicians and not politicians take these decisions, that where the clinicians are unable to support an IPTR request, there has to be a proper explanation for the clinical reasons why such an application has not been successful. I fully appreciate many members will have constituents in a similar situation, and I hope once we implement the recommendations, and we'll wait to see the recommendations from the committee, by then we will then be able to implement a more robust system which can deal with this delicate situation more sensitively in future.
Question 14, David Torrance.
Presiding Officer, to ask the Scottish Government what action the NHS is taking to improve its services for users of the British Sign Language.
Minister.
The quality team within NHS Health Scotland is working to strengthen the quality of access for all in NHS Scotland through their Health Inequalities Impact Assessment. This will include those who use British Sign Language. In addition, we are also supporting NHS 24 to provide an in-house centralised resource for NHS Scotland of BSL interpreters through the funding of 4 places on the Heriot-Watt University BSL undergraduate degree for 4 years.
David Torrance.
While interpreting services utilised by NHS 5 for the deaf community is excellent, does the Minister agree that improving this coordination is crucial for BSL users who are in need of additional assistance in order to communicate and have their medical needs fully understood and addressed by medical staff and themselves?
Minister.
Well, I fully agree with the member that good coordination of BSL services is absolutely crucial if we are to ensure that patients receive the type of person-centred care that they require. I am aware of the changes that were made in NHS Fife area where they brought the BSL service in-house, and that's allowed them to enhance the quality of the way in which that service is provided. Alongside that, our hospital staff have very clear and easy to follow protocols which are used to accessing an interpreter for BSL users when they go to hospital. But of course, this is an area where I've got no doubt we can make further progress in ensuring that patients get the type of support that's necessary should they be BSL users. And the changes which have taken place within NHS Fife area clearly will help to improve the quality of services which are being delivered there.
Question 15, Patrick Harvey.
Thank you. To ask the Scottish Government how it is reducing the health impacts of poor air quality in cities.
Cabinet Secretary.
The Scottish Government supports a number of measures, both local and national, to successfully tackle air pollution. These include the establishment of a statutory framework and clear strategic aim for both air quality and transport, supporting the development of renewable energy, providing grant funding for local authority actions, and providing advice and information through the Scottish Air Quality website and Scotland's Environment Web.
Patrick Harvey.
The Minister describes a framework of measures which is clearly failing to provide air that's fit to breathe in some of our cities. Glaswegians and our many visitors who will of course arrive in great numbers next year are subjected to the worst air quality in the whole of the UK. In fact, it's the 5th worst city in the whole of Europe for air pollution. Will the Government not accept that this is a public health issue which needs much greater action and not buck-passing either to local authorities or to Europe where the rules are set? Will the Scottish Government acknowledge that far more needs to be done where councils have such an abysmal record in providing air that's fit to breathe for people in Scotland?
Minister.
Well, I'm sure that everyone would agree that improving air quality is an important measure, and although there's a range of work that's been taken forward both at a national and a local level, that there have been areas where improvements have been gained, but I recognise in some areas that level of improvement hasn't been as fast or at a greater level as some members would like to see. I've got no doubt that my ministerial colleagues in both the environment and the transport side will continue to take forward measures to help to make sure that we drive up the standards of air quality in Scotland into the years to come.
That ends questions to